Doctor is in, and today it's Dr. Yashar Kalani with Ascension Saint John Medicine talking about Traumatic Brain Injury Awareness Month. Welcome in, Dr. Kalani.
Thank you.
Good to see you, my friend.
Appreciate you. Good to see you, too.
For those who don't remember, his team is who helped save Tulsa police officer Yashar Kalani after he was shot in the head a couple of years ago. We did a story about it and stuff, so it's good to see you again.
Yeah, absolute pleasure to be here. Thank you.
So speaking of traumatic brain injuries, tell us a little bit about what that is and what that can look like.
Traumatic brain injury is an injury to the brain that results in dysfunction of the brain. And it can really affect any age group. You see it in young people. You see it actually often people who play football, for example, in the high school level. You see it in girls who participate in tumbling and cheerleading. And then you see it all the way into older adults who may experience falls. And as a result of the fall, they may hit their head and result in bleeding or dysfunction in the brain. And really the treatment for it in most cases is conservative treatment, meaning we take care of them, we support them, we allow time for the brain to recover from the injury. But really it requires a multidisciplinary team to do the proper long-term care, because the patients are going to need physical therapy, sometimes occupational therapy. In the most severe cases like RS, they require admission to a dedicated neurointensive care unit where you've got trauma doctors, neurologists, and neurosurgeons taking care of them.
When should someone get checked out if they think it's possible they could have a TBI?
Sometimes it could be subtle personality changes. So, you know, if there's been an injury to the brain, for example, athletes in the high school level, for example, have a concussion and they're not behaving correctly. Maybe they're being forgetful. If their speech is impacted, if they've got arm or leg weakness, those are all signs that you want to get checked out and you want to get the care that you need.
Are there some misconceptions about TBIs and when it comes to recovering from them?
Yeah. Often people think that traumatic brain injury is something that you may never recover from, or on the other end of the spectrum, they think that the recovery may be pretty prompt and quick. Often this is something that, especially if it's repetitive, it's going to require long-term recovery and long-term support from people's loved ones, engagement with you know, folks who work with physical therapy and occupational therapy, as I mentioned, and also speech therapy, helping them reintegrate back into their daily lives. So the really recovery is a long-term process for these cases.
But it's possible for someone to get back to normal life.
Yeah, I mean, again, I think Officer Kalani is a great example of it. I mean, when he presented to Ascension Saint John after the shooting, we were able to rush him to the operative theater to get the hematoma taken out and the reconstruction done. But then over the next 2 years, it required really a multidisciplinary team of folks to allow him to recover enough that he's now back working at Tulsa Police Department. And that really is a great example of a save that's possible through interdisciplinary care of these patients.
One thing I want to touch on, how important is it to not rush back to the activity after you suffer one of these injuries?
Hugely important. Again, I think we mentioned football a few times. You know, I know football has a huge following in the state of Oklahoma, but if you don't allow for adequate recovery, the second injury can be more devastating and significantly worse and more difficult to recover from. So you really want to allow time for the patient to recover before they resume activity, especially activity that's going to potentially result in more injury.
Dr. Kalani, thank you so much for being here. We appreciate